Hello everyone, welcome back to the latest update series of Drishti IAS. This is Divya Kamatra and today we are discussing about a very important development, that is the first dengue vaccine. That's right, we have developed the first dengue vaccine. Let's understand what that is and how does it work. So India has approved its first vaccine, giving Japanese drug maker Takeda pharmaceutical company India, that is Indian arm, an authorization for Qdenga. What is the name here? Qdenga. Alright. The permission has been granted for this. The Drug Controller General of India has given a live attenuated vaccine for people aged 4 to 60. Remember the age. What is the age? 4 to 60. For whom is this? For people aged 4 to 60 under the CT20 New Drugs and Clinical Trial Rule 2019. That Takeda India said in a statement. Already they have done this. Qdenga can be administered without pre-vaccination screening, regardless of prior dengue exposure. Even if you've not had any exposure, even then the vaccine can be administered. Alright, let's understand what the vaccine is, how does it work, and what other features does it have. First of all, let's talk about the approval. Regulatory approval came from DCGI. They granted market authorization. Market authorization has come already, and via Indian subsidiaries also. Target age group, as we discussed, 4 to 60 under the new drug clinical trials rule, and no pre-screening is required. What is that? Unlike some earlier dengue vaccines, Qdenga can be given without testing for prior dengue infection. You don't need to test for any infection. You can just directly give the vaccination. It is safe and effective regardless whether a person has had fever or before or not. Right? What is the dosing regimen? 2-dose series. It is a 2-dose series, 0.5 ml given subcutaneously 3 months apart, right? Yeah, one today, one 3 months later, 2 doses of 0.5 ml each. How many doses do we have? 2 doses for this, and it is safe regardless if you're testing, regardless of whether you have had dengue before or not. It is safe anyway, all right? So before we understand more about it, let me tell you about the new session sale that is going on. A reminder for you all, it is running till 22nd of July, just 22nd of July, and you have up to 50% off on all online live courses like UPSC, PCS, teaching exam, judiciary, SSC, CUET, all of them. You can join that from Drishti Learning app as well as Drishti IAS website. And if you face any problem or you have any more queries regarding this, you can call us on 87501 87501. All right. Okay. Moving forward, we have vaccine efficacy and safety. What efficacy and safety do we have for this? The broad protection that is given is that it is a tetravalent live attenuated vaccine that is specifically designed to protect against all 4 dengue virus serotypes, that is DENV-1, DENV-2, DENV-3 and DENV-4 will get protection against all 4 of them, not specifically working for any one of them. We'll be getting from all 4 of them a proper protection, right? High efficacy, global phase 3 trials including 20,000 participants has shown 80.2% overall efficacy against lab confirmed dengue at 12 months post second dose. 90% efficacy, related hospitalizations at 18 months. 84.1% sustained protection against hospitalization through 4.5 years. This is the success rate that it has shown, and according to the local data, approval was supported by Indian phase 3 trial also, where participants aged 4 to 60 confirmed that vaccine was well tolerated, safe and produced strong immune response to this structure. Alright, that is vaccine efficacy. If we talk about the global standing and significance for India, Qdenga is already approved in 43 countries. It is already approved in 43 countries like Brazil, Argentina, Colombia, Indonesia. There were 32 million doses distributed globally. Now it has WHO pre-qualification for international agency procurement also. India's disease burden, if we talk about India, accounts for nearly 1/3 of world's total dengue burden, right? And according to that, we definitely need this. So what is the treatment gap? Because it had no specific antiviral treatment. It doesn't have any specific antiviral treatment. It is supportive symptom focused. So preventive vaccines were a vital line of defense alongside mosquito control. We were running on preventive vaccine because obviously there is no antiviral treatment, specific antiviral treatment. So in domestic pipeline, what have we done? Indian pharmaceutical companies including Panacea Biotech, Bharat Biotech, Serum Institute of India and Indian Immunologicals They are currently testing their own candidate dengue vaccines in clinical trials, and if they come forward with something better, obviously we'll have that too. But for now, this is what we have approved. That is Qdenga. What is it? Qdenga. Clear? All right. If we compare this globally, if we compare this on a global scenario, we'll see that who is the developer here? Who is the developer here? Takeda Pharmaceuticals for Qdenga, right? Then we have Dengue-Vexia for Dengue-Vexia we have France. For Butantan DV we have Brazil and US. All right. What are the viral backbones here? Dengue virus type 2 in Qdenga. Yellow fever 17D drain in Dengue-Vexia, and live attenuated chimeric dengue in Butantan, right? What are the dosing schedules? Dosing schedule is 2 doses for Qdenga, 3 months apart. We just talked about it. Then Dengue-Vexia, they have 3 doses, 0, 6 and 12. Now today, then after 6 months, and then after 12 months. 3 doses are there. In Butantan, there's only 1 single dose. For age group, we have 4 to 60. WHO has given 6 to 16 years. Dengue-Vexia 6 to 45 and Butantan 12 to 59. These are the age groups that can benefit from this. Is there a prior infection needed for this vaccine? For Qdenga, we said that no history, regardless of the history with dengue virus, you can still get this. And Dengue-Vexia, yes, they need seropositive only. In case of seropositive only, you can get this vaccine. And in Butantan also, no history is required here, right? In terms of global status, we see it has been approved in 40 plus countries. Qdenga has been approved in 40 plus countries. Dengue-Vexia has been phased out, is heavily restricted due to low demand or risk. There are high risks related to Dengue-Vexia. It is very limited today in the global scenario if we talk about that. Then Butantan DV approved in Brazil, tech license to global developers also. So that is still working. Butantan is working, Qdenga is now also working, and it is working in India also. And other than that, we had Dengue-Vexia, but it is getting phased out. Clear? This is regarding the global comparison of the medicines that are going on and how do they work. What are the different criteria that they can work upon? And what do we have? We have Qdenga. Clear? All right. A reminder once again for you, IAS GS Foundation course along with mains and optional courses, they're all on sale here. Up to 50% off for structured classes, prelims, mains, capsules, booklets, mains evaluation, 3 years for prelims, current affairs magazines, current affairs test series, prelims test series specifically. All right. So you have all that under this, and that also up to 50% off, just slashed out price. Right. Don't miss out the chance. Don't miss out the chance. Take benefit of this as soon as possible. And if you face any problems, have any more queries, you can give us a call on 87501 87501. Clear? All right. Let us know your answer in the comment section. We'll look out for that. And that's about it. That was our session for the day. Thank you so much for joining in. That was about Qdenga, the final medicine that India has approved. All right. I hope you understood all about that. All the important facts. Yes? All right. We'll see you in the next session. Till then, take care. Thank you. Bye-bye.
For more informative content, like, share and subscribe. And do not forget to press the bell icon to get the notifications.